Welcome to Legends to Leaders, the podcast dedicated to bringing the wisdom of perioperative legends to the fresh perspectives of newly promoted directors of surgical services. Today, we're honored to kick off the journey with a true icon, Adrienne Oden. Adrienne will be discussing aligning physician values with organizational goals. She has 20 years of hands-on nursing and executive leadership experience from the OR frontline to directing large-scale surgical programs, academic medical centers, community, and critical access settings. She has shaped perioperative services across the country. She served as perioperative leader and consultant through Whitman Partners for organizations such as Lake Chelan Community Hospital and also with major systems. She's a seasoned nurse, CNOR certified, and MSN prepared. Adrienne, welcome to Legends to Leaders. It's an absolute privilege to have you and share your wisdom with the next generation of directors of surgical services.
Thank you, Josiah. I'm happy to be here.
Let's start here. How do you assess surgeon values and preferences when you first start as a director of surgical services?
The perioperative director has multiple groups to work with, and I think a lot of times we go in focusing on the nurses, focusing on the staff, but the bottom line is the physicians are, a third group in there, and if you don't have alignment and a working relationship with them, nothing's going to work. So I think it's really important to focus on that physician group very intentionally. You go in with an open mind and you go in asking questions with a true curiosity to hear them. I always prefer face to face. I am there though to truly listen to them. I think it's really important for you to understand and for your physician groups as well as your staff groups to understand what they value and then how that does align with the organization. Every organization I've worked with has had basically the same values. They want quality patient care. They want financial stewardship or responsible finances. They want patient satisfaction. And if you sit and talk to a group of, let's say, surgeons, what do they want? They want their cases to go on time. They want to have knowledgeable staff. They don't want delays. They don't want errors. So I listen to them. I use their language. But at some point, I think it's important for us to realize it's not an us and them. It's not administration against physicians. Number one, physicians are always too busy to talk to anybody. So yes, I always go to them if I can. Number one, I'll go to them in the clinical setting and I'll go to them in scrubs. There is a clinical credibility to that. If I'm behind the red line, that gives me even more of an entry to have a conversation. Your surgeons will usually tell you, I don't agree with what the hospital is doing, or the hospital's only worried about money, or whatever. I guarantee they're not misaligned. Doctors want to give good care and they want to give it without error. So I don't think they're misaligned. They may think they are misaligned. And to me, it has to do with how have our KPIs been communicated. You've got to put it in their language of how does your goal match this? I do think that decision making and when you're saying no on something as personal as block time or on a product request, it isn't me, the director, saying it. I am one of the people that is in a process. So it's really important that you have some sort of an executive team that shares that. And it has to have physicians on it. Now, let's say that I walk in and that's not there. I will say to my surgeon, let me do a little bit of investigation on how this has been decided in the past, but it's based on data. We've got some criteria because I want to treat you as fairly as I do the next physician who comes. People that have worked with me laugh all the time because I never say we're going to do something or here's a new policy. I say I'd like to trial something. Probably the biggest concept is that communication. You cannot be in an office. You cannot be in meetings. You cannot be making spreadsheets. And develop that. Spend your first 30 days as face forward as you possibly can. You're going to learn a lot, but that's going to open the door so that you can go to them and say, I need your help on something.